Last December 2019, Chinese authorities notified the world that a virus was in their communities. The virus was known as the Severe Acute Respiratory Syndrome-related Coronavirus 2, which causes called COVID-19. COVID-19 was the name decided to avoid stigma and make it easier to pronounce. COVID-19 is a type of virus. A virus can only make more of itself by entering a living cell. Its main way of spreading seems to be caused by droplet infection when people sneeze or cough, or when you touch someone who is ill and then you touch your face, nose, or mouth. Its destinations are the intestines, the spleen, or the lungs, where it can cause the most dramatic effect. COVID-19 is a global pandemic that spreads rapidly, especially in a dense population. A pandemic is an epidemic that has spread across a large region, for instance, multiple continents. To win our fight against COVID-19, we must make it a slow pandemic. When a pandemic spreads rapidly, healthcare and hospitals gets overwhelmed with a sudden surge of patients. Work gets more demanding, stressing, and exhausting. Our health workers, which in return makes them sick. When a fast pandemic occurs, more people will die as a result. So how can we make it a slow pandemic? A slow pandemic is when the disease spreads at a controllable scale where our healthcare can be more effective. To make it possible to slow down its spread, civilians must follow community quarantines and lockdown to reduce the chance of spread. As uncomfortable as this may sound, but it is a sure way to help. While it is good to maintain our health, take vitamins and eat healthy while staying in quarantine. But it doesn't help when we spread false information about the virus, as this causes panic and disorders. In summary, while quarantine may not be the best experience, this is a sure way that civilians can help, so that we, health professionals, can do our job properly. As scary as this might seem, as long as we turn it into a slow pandemic, our healthcare would triumph when we all help each other.